Hey guys, Dr. Watt from Pinecrest Chiropractic. Let's talk about 3 tests that you can do at home to check for sciatica. Now, as we've talked about before, sciatica is just inflammation of the sciatic nerve, which comes from L4 down to S3. And these 5 nerves bundle together. And so that sciatic is the sciatic nerve. The means it's inflamed or ticked off. And so that sciatica type irritation can happen in the lumbar spine, and it's a super common area for it to happen. But it can also happen in the SI or in the piriformis or other areas of that nerve getting entrapped, creating those same types of symptoms where the pain starts in this area and then shoots down the leg, sometimes to the knee, sometimes the calf, sometimes all the way to the foot and the toes. And so how do we differentiate where that pain is coming from? Well, that's what we're going to use these 3 tests for. Now, this first test is a straight leg raise or a variation of it. So we'll have the patient sit down, maybe even slouch forward just a little bit and kick the affected leg forward, keeping those toes pointed up towards the ceiling or towards their head. And that's going to put tension on that sciatic nerve. And so this can put tension in multiple areas, but with you being sitting and flexed forward, that's really going to put pressure on the disc. So this is going to confirm that it's most likely coming from a disc. We'll confirm this by having the patient lay on the back and do that same type of test. And so we'll kick this leg up towards the ceiling. And so this is called a straight leg raise. And then we'll have them point the toes up towards the head once again. If patients are having sciatic type irritation, we're gonna see those symptoms reproduce or happen again and again. Next test we're gonna flip over onto your belly. And so this is where we're gonna check the internal and external rotation of the hip, because that piriformis runs from your sacrum all the way out to the outside of the hip here. And that sciatic nerve runs right along it. Some patients runs through it, some below, some above. It all depends on the patient. And so what we'll do is we'll bend the knee up and we'll push that foot outwards, creating an internal rotation of the hip, or push it across this way, creating an external rotation of the hip. Most of the time, we're gonna see some sort of variation left to right when we compare the 2 sides. When we have a drastic variation, especially on the affected side, that may mean some of our symptoms are coming from a tight piriformis affecting that sciatic nerve. But especially when we try and come across the leg here, that's gonna make it shorter. Going out is making that piriformis longer. So that's trying to affect that muscle and see what that does to the nerve. The last test that we're gonna do, this one's gonna be a test for the SI or the sacroiliac joints. There are 2 of these on either side of the sacrum. And so we're gonna test her right one right now, where we're gonna lift that side up. I'm gonna be underneath her knee here, and we're gonna lift that leg up towards the sky and apply a little bit of pressure towards the floor here. And that's gonna essentially jam that SI joint together. Now, if that reproduces those same symptoms going down the leg again, that may mean we're looking at an SI joint creating these sciatica type inflammation. So that's 3 different tests that you can do to help differentiate, are your sciatica symptoms coming from the low back and disc? Are they coming from the SI joint, or are they coming from the piriformis specifically? If you want to figure out how to better differentiate those 3 tests, come on in, let's talk about it.